What this highlights is really a broader conversation about the cost of health care. The United States spends more per capita on health care than any other wealthy country in the world. So, how did we get to this point, and how much of the financial burden is falling on patients? Newsy's Tadevik Oprikyan has our story.
Americans are spending more on health care today than at any time in nearly 4 decades. Premiums are up about 22% in just the past 5 years. That's according to a Kaiser Family Foundation survey. It's costing everyone more, from employees to employers to the government.
There's so much uncertainty right now that insurers are probably really reluctant to cut premiums.
One of the main drivers are the costs associated with billing you and your insurer. An estimated 15 to 30% of healthcare spending is on administrative services, according to one analysis by the Massachusetts Medical Society. Behind the scenes, there are large teams of staff with an expertise in medical coding who decide how your visit is billed and how providers get paid for seeing you. Doctors complain their offices now spend a majority of your appointment time filling out complex paperwork or calling your insurance to explain why they perform certain procedures or prescribed treatments. And FaceTime with a healthcare provider has been cut to an average of 13 to 16 minutes per visit. That was discovered by the Society of Actuaries in an analysis last year.
We wanted to be the doctor to give a lollipop and spend time with our patients, and this is what we got. Is this what we all expected to be as a doctor? Did anybody envision being a family doc doing this? This guy's not staring at the patient. He's miserable. He's typing in the computer.
Now some doctors and insurance specialists have taken to social media to teach patients how to negotiate medical bills themselves.
I am a medical insurance specialist. I have 26 years experience in this field. I fight to get claims paid. Your insurance company will deny claims just so they don't have to pay it.
America's traditional fee-for-service model is also inflating prices. Under this system, hospitals and providers are not paid based on patient outcome. Instead, they are reimbursed based on how many patients they see and how many services they perform. So there are financial incentives to do more tests or treatments. Physicians say fighting insurance is often a losing battle.
When they control us like they have, and we keep trying, we burn out. It's like a bully punching you in the face saying, how can I help? And then just pounding you. You're like, well, for one, you can stop punching me in the freaking face.
Some of the highest earning insurers are also reporting bigger profits. CVS Health raked in more than $7 billion in earnings last year. That's more than a 100% jump over the past decade. United Healthcare's profits have soared over 230% since 2010. They pocketed more than $15 billion last year, all while average Americans struggle to keep up, with an estimated 1 in 5 having medical bills in collections. Tadevik Oprikyan, Newsy, Chicago.
Very insightful story there. Well, medical costs are expected to rise another 5% next year. One idea gaining traction is a model called direct primary care. It's billed as the opposite of our current fee-for-service idea, but how does it work? Dr. Mitchell Lee joins me now tonight from Chicago. He is a board-certified emergency physician with a direct pharmacy care practice. Thanks so much for coming on, Dr. Lee.
Thank you for having me.
Yeah, we'll talk about what direct primary care is in just a moment, what it means, but can you help us understand, first up, why healthcare costs so much in this country?
It's a short segment, but there is a lot of layers of middlemen, a lot of layers of corruption, and opacity. There's really no transparency in anything that we do. And you guys mentioned some of the issues with insurance companies, and you mentioned some of the issues with billing and administration. It goes far beyond that with pharmacy benefit managers, with group purchasing organizations, and a layer that many people don't see, which is actually Wall Street firms owning doctor groups. So usually physicians are pitted against insurers, and that's bad enough. But then when you add another layer of profiteers, basically Wall Street and private equity firms owning physician groups, which is an estimated 65% of emergency departments that are outsourced to these groups, you're talking about another layer of profit extraction invested in creating the lowest cost care to maximize investor profits, meaning the highest cost care to patients at the lowest quality. And that's where we're heading toward.
Yes, those layers, that's eye-opening right there. But is there legislation from Washington that could do something to fix these problems? Or in your view, is the healthcare system in the U.S. just inherently always going to be more expensive if these layers continue as you describe?
That's sort of my concern. I don't want to go down a Medicare for all rabbit hole, but I think that people who support something like a single-payer system or Medicare for all are completely justified in saying that we should be able to do it. We are a wealthy enough nation that we absolutely should be able to provide high-quality care to everybody in the country. But with the entrenched interests that we have, both in terms of insurance companies, private equity companies, and their entrenched support of bipartisan candidates, I don't think that we're going to reach any magical bullet going directly through legislation in the near future.
Well, let's talk about what you do. It's a model called direct primary care. How is it different from a typical doctor visit that we're used to?
Well, you guys obviously had seen a little bit of Doug Farrago. He's a leader, a charismatic leader in the direct primary care field. You played some of his segments earlier. And it's really quite simple when you take out all of the middlemen. And some of us think, how could we possibly do that? Well, medicine is expensive. The truth is that the majority of medicine is not very expensive. Yes, physicians went to school and studied for a long time. Now we're coming out with $300,000 or $400,000 in medical debt, or educational debt, excuse me. Medical debt might be a little bit of a Freudian slip there. And so it's difficult for us to start a practice on our own. But when you take out all of those middlemen, insurance companies, instead of being employed by a hospital, instead of being employed by a private equity firm, the costs just drop dramatically, and you can get a real meaningful relationship again with your physician.
Yeah, and direct primary care has membership fees, and when patients need specialists or urgent care or a hospital, they either need to pay out of pocket or pay for insurance. Isn't this model more expensive for patients?
Yeah, so that's a great question. Most people equate, or at least they think about concierge medicine when they hear cash paying primary care. And it really couldn't be more, further from the truth. We're looking at actually decreasing the cost of insurance, because right now we're paying for insurance and expecting them to cover routine care, and this is analogous to us expecting our car insurance to cover our oil changes and routine brake care or something. So if you went to an auto mechanic and they were to send a claim to your auto insurance for an oil change, that oil change is not going to cost $30 or $40 anymore. So this is really cutting all of that out and excising all of the low-cost care, and then allowing for what we would refer to as a wraparound plan. So we want insurance to work like insurance should, which is basically when there's a catastrophic event or something very expensive, like you're hospitalized on a ventilator with COVID, then we want to save you from bankruptcy and get you that good care. But for routine care, we're talking $60 to $100 a month is the typical fee for direct primary care. If you save one urgent care visit or one emergency department visit from that, you've already made up your money, and now you have a real relationship with a physician.
Direct primary care. Thank you for your insights. Thank you for helping us understand the system. It is a complex one. Dr. Mitchell Lee, we appreciate your time.
Thank you for having me.